As I worked on my concept map for elimination dysfunction, I started by focusing on urinary dysfunction. And by the way, I realized how interconnected everything is. One of the more challenging areas was organizing the differences between the four main mechanisms of motility, neuromuscular function, altered patency, and altered perfusion, and figuring out which diseases fit under each other. What helped me the most was breaking it down by the actual physiology. For example, under altered motility, I looked at conditions like hydronephrosis, which can result from things like kidney stones or urinary obstruction. It made sense once I thought about how urine flows gets blocked and starts backing up in the kidney. Treatments like stent placement or lithotripsy were easy to connect once I understood what the underlying problem was. Then, looking at altered neuromuscular function, I focused on diseases like neurogenic bladder, spinal cord injury, neurogenic bladder, which can be caused by something like spinal cord injury, one of the causes, or diabetic neuropathy, another cause. These really helped me see how nerve damage can prevent the bladder from contracting or relaxing properly. Treatments like intermittent catheterization or anticholinergic meds now made more sense because they help manage that disrupted nerve signaling. What really became clearer for me during this part of was altered perfusion. Before this, I kind of understood that something like renal artery stenosis could affect kidney function, but mapping it out helped me connect that to something more acute, like acute kidney injury. It all came together when I could visualize how a drop of in blood flow reduces filtration and eventually impacts urine output. And seeing how treatments like IV fluids or blood pressure management directly target that perfusion issue helped bring it full circle. After wrapping up urinary dysfunction, I moved into bowel dysfunction, and I thought this part would be more straightforward, but I was wrong. I noticed some confusion when trying to separate motility issues from neuromuscular problems. Both can cause constipation or incontinence, so it really made me think. For motility, I looked at causes like low fiber intake or medications like opioids and how they lead to constipation. That made sense once I paired it with treatments like laxative or dietary changes. But when I got to neuromuscular function, I had to rethink things. Conditions like Parkinson's disease or multiple sclerosis affect how the nerves and muscles of the bowel communicate, leading to bowel incontinence rather than constipation. Treatments like bowel training programs or anti diarrheal medications became more meaningful when I connected them to the neuromuscular root of the problem. The one that surprised me was altered patency, especially when looking at bowel obstruction. I thought I understood it, but mapping it out made me realize I hadn't been thinking about the cause, like whether the obstruction was due to colorectal cancer or fecal impaction. The treatment options, surgery versus manual disimpaction, or enemas, suddenly seemed much more specific and purposeful. Overall, organizing the map by mechanism instead of just by disease really helped me understand the why behind the symptoms and treatments. It made me think more clinically and connect things that I had previously memorized in isolation. This definitely helped me see the bigger picture.